Coming up next is the Dr. Kim Taylor Show. Here's your chance to talk about what matters to you. Although you'll receive helpful advice from Dr. Kim, remember this is not to be construed as any form of psychotherapy, diagnosis or treatment, and cannot replace a therapeutic relationship with a mental health professional. You can reach Dr. Kim by calling 564-1290 or 866-564-1290. You can also listen live on the internet at drkimtaylorshow.com. Now, here's Dr. Kim.
It's great to be with you again today for this hour of the week where we really get to talk about feelings. And not just how you're feeling, but also what you're going to do about those feelings once you're really able to acknowledge them. And isn't that an art these days, to turn off the devices and the constant demands for our attention and just take a few moments to reflect on your own thoughts and how they are affecting you? Do they bring you strength and vitality, or are they weighing you down and feeling like a burden? Well, this is the time of the week when you can share what's troubling you and to get some helpful advice to help you lighten your own load. You can just give me a call and we can work it out together to find a solution that's going to work best for you. I'm here every Thursday afternoon, so now the rest is up to you. Today, our conversation turns to eating disorders and the treatment options that are available right here in our community of Santa Barbara. I have with me in the studio today 3 local experts in the field of eating disorders: Dr. Marjorie GIES, Linda Wells, and Rachel Finch. And they are here to answer your questions and to really offer some in-depth knowledge into the issues surrounding eating disorders, as well as how their different treatment facilities can be effective in treating specific problems. So if you have a question, feel free to call in today at 805-564-1290 or email me at drkim@drkimtaylorshow.com and we will answer your questions on air. There's really no getting around it. Food plays a very important part in all of our lives, as we need a positive relationship with food to nourish ourselves as well as to keep us healthy throughout our lives. But for those of you who suffer from a problem with eating, it can be really difficult to understand that eating disorders are not entirely about food. In fact, an eating disorder is a dangerous mental illness. It's not a lifestyle choice. It's not a diet gone wrong or a passing fad. An eating disorder is characterized when eating, exercise, and body and weight or shape become an unhealthy preoccupation in someone's life. There are a variety of eating disorders that can affect a person, and they have different characteristics and different causes. However, in general, eating disorders can be linked to low self-esteem and an attempt by the person to deal with underlying psychological issues through practicing an unhealthy relationship with food. We definitely know that eating disorders occur in both men and women, young and old, rich and poor, and from all cultural backgrounds. So it's an important topic to discuss and to help people to try to understand the issues that underlie this and to be able to seek the appropriate treatment to heal. And that's just what we're going to do today. So if you would like to join in on this conversation, or if you have a question, just pick up the phone and give me a call. You can reach me now at 564-1290 or toll free at 866-564-1290. Or for those of you who would rather send me your questions by email, send them to Dr. Kim at drkimtaylorshow.com. I'm Dr. Kim, and I will be right back with my guests after these short messages.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
We all know that food plays a very important part in our lives, but when the relationship to food becomes unhealthy, it can really lead to very serious problems. So today I have with me 3 experts in the field of eating disorders. The first one is Dr. Marjorie GIES. She is here, and she is a psychiatrist, and she's also the medical director of La Ventana Treatment Center. Also, Linda Wells, who is a licensed clinical social worker, and she has worked as a therapist in private practice, specializing in the field of eating disorders. And she is currently the owner and clinical director of the Eating Disorder Center of Santa Barbara. And third, I have with me Rachel Finch, who is a licensed marriage and family therapist, and she also specializes in treating eating disorders. And she maintains a private practice, but she also works as the lead therapist at La Ventana Treatment Program here in Santa Barbara. So welcome to the program, ladies. I'm really happy to have you here.
Thank you.
Thank you.
This is a very prevalent problem, and we are here just trying to help those who have this issue, who are struggling with it, and really want to know about treatment. So I want to talk about the causes of eating disorders as well as how eating disorders can be treated. But let's start by really defining the common types of eating disorders. So, Linda, would you like to start?
Well, there are several different kinds of eating disorders. The prevalent ones are anorexia nervosa, bulimia nervosa, and binge eating disorder is another diagnosis. We also have specified feeding and eating disorders that fall outside of those categories, like exercise disorder. Mm-hmm. And anorexia is typically reflected in a major focus on obsession with weight and body image, shape, usually 15% body weight loss.
So that is more about restricting food.
That's right. Mm-hmm. And bulimia nervosa is typically binge eating patterns with various compensating behaviors related to that. So that might be anything from purging or vomiting to laxatives to exercise disorder and all of the above, sometimes at the same time.
Mm-hmm. And then the binge eating is...
Binge eating tends to be a little different in that it may or may not have a purging aspect to it at all. Sometimes people restrict, but they typically binge up to 3 hours, sometimes more, and it's an excessive amount of food over and above what an average person would consume in that period of time.
So most of the time, eating disorders are really associated with the wish to be thin, that society really puts out all of the images that thin is good, and the thinner you are, the better you are. What is that slogan? You can never be too thin or too rich. Yes. Okay. So that is, in fact, perhaps part of it, but there's a lot more that causes this. So what are the causes and what leads to a eating disorder? And maybe, Dr. GIES, you can answer some of that.
Well, one of the main causes is going on a severe diet and restricting, getting into a starvation state, which can, in some people, lead to ultimately binging, and then the binge-purge cycle can start. Also, with anorexia, some people start with simply getting sick and losing weight as part of an illness, and that can set off a cascade of disordered eating patterns.
It can start out for one reason, for instance, just wanting to lose a bit of weight or to be a little thinner or to fit into a bathing suit or because you're going out on a hot date. So it can start out that way. But how does it turn and why does it turn?
Well, there are certainly individual risk factors that would render one person more vulnerable to a diet going askew. We do know that temperament, which is truly a reflection of the nervous system you inherit, that is one risk factor, the type of temperament you're born with. And we know there are certain genetic factors. Additionally, for example, many people with eating disorders have a family history of alcoholism or substance abuse, depression, anxiety, as well as eating disorders. So there's some commonality in terms of vulnerability. And perhaps in times of stress, one individual in a family might gravitate towards severe restriction and an eating disorder, and a sibling may turn to substances, but they would have inherited a similar vulnerability.
What I'm hearing you say is that basically this is a coping mechanism, that people either learn it and or they try it, but it is a way to cope with something going on in their life that is overwhelming to them, and this is just the thing that they pick in order to soothe themselves and try to get through a difficult situation.
I absolutely agree with that, and anyone working in this field comes to each client with a sense of respect, that they know that each individual is doing the best they can and that these behaviors are somehow helping them. But at a certain point, the negative consequences are outweighing the positives. And I think anyone in this field grasps that complexity.
Is this also an outshoot of maybe any kind of emotional abuse, sexual abuse, post-traumatic stress?
Mm-hmm. Yeah, absolutely. And I think that...
This is Rachel Finch, yes.
And I would just say that Dr. GIES really did a good job of highlighting the complexity of it, and that there are many factors that contribute to the development of an eating disorder. And as you said, certainly a history of trauma can contribute to the development of an eating disorder. Anytime something occurs in someone's life that is overwhelming and surpasses their ability to cope, there has to be some other resource for them. And so an eating disorder might be a way to feel in control and to feel powerful when there's been an incident of abuse or chronic abuse over time.
And is this also something that somebody who has low self-esteem and or they're having anxiety in some other area of their life, so there might be something that is coexisting with this, whether it's anxiety or depression?
Absolutely. We very commonly see depression or anxiety, as well as obsessive compulsive disorder, as kind of co-occurring issues alongside with the eating disorder. So that's very common.
And would you explain what type of disorder is this? Is it more anxiety? Is it more depression? Is it obsessive compulsive? Is it just so that people can start to understand the origins of this? How would you explain it?
That is a tough question to answer simply, but each clinician, when they first meet with someone, one of their first tasks is to try to discern if there was a pre-existing condition. For example, if someone initially had obsessive compulsive disorder and then the eating disorder is simply an ongoing manifestation, and then the treatment would certainly include treating for the obsessive compulsive disorder. A lot of individuals who starve themselves can actually develop obsessive compulsive symptoms simply from starvation, and food for them would be the best medicine.
How would you really go about trying to figure out if you or a loved one has an actual clinical eating disorder? What are the signs? What are the symptoms that one would look for?
This is Linda. Mm-hmm. And first and foremost, backing up a little bit, that typically an eating disorder does start with a diet. So diets aren't this neutral, safe behavior. It actually often can lead into a number of different eating disorder patterns or disordered eating, which then can lead into an eating disorder. So what we're typically looking for is somebody who's obsessed with weight and shape, often feels very poorly about their body or their body image, maybe has had some kind of trauma or event or health issue that maybe it has created a control issue for them, or the eating disorder lends itself to a way of dealing with the anxiety through control. Behaviors like using the restroom right after eating a meal, that might be one indication. Somebody who's really anxious about eating or eating around others, or very restrictive in terms of what they'll eat. Even sort of a perfectionistic attitude about organic or whatever can go awry, and the next thing we know, somebody's exhibiting severe eating disorder issues. Mm-hmm. And so behaviors that we think of as not that serious can quickly lead into a very serious eating disorders within weeks or months.
So parents should be looking for those kinds of signs within their children. It's also true that a lot of them use different kinds of ways to get rid of the food, whether it's throwing up or whether it's laxatives, things like that. Is there anything else that they should really look to as real red flags for this kind of behavior? Because I think it's very important that you know the difference between if it's just going on a diet and trying to lose a few pounds or whether it's crossed that line.
Mm-hmm. Yeah, well, this is Rachel, and I would add to what Linda just said, certainly any drastic weight loss or weight gain, although it's a myth that, someone has to be really thin to have an eating disorder. That's not always the case. Often someone can present as quote-unquote normal looking. And so some other good signs would be isolating or missing out on social situations and not attending events with friends, and just isolating in one's room or spending a lot of time alone be another sign.
Okay.
And excessive exercise, I think, also is something to really be on the lookout for. And that, again, can be sort of subtle in our Western culture that's so pro-fitness. But if somebody's exercising several times a day, or not eating or hydrating enough before they exercise, that may be a clue that exercise is part of the picture, and that also needs to be treated.
So these are all good signs for people to know that you need to watch out for those, and that may be an early sign of something else that is going on. So we are going to take a short break. I'll be right back with my experts.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
Today we're talking about eating disorders and the treatment options that are available to us here in Santa Barbara. Once more, eating disorders are not a lifestyle choice or a diet that's gone wrong or a passing fad. It really is a very serious mental disorder. So if you have a question about this, if you would like to join in the conversation with us, please feel free to do so with my experts here, Dr. Marjorie GIES, Linda Wells, and Rachel Finch. Here's my question to the three of you, but I'm going to start with Dr. GIES. Why is it so important to seek treatment for these kinds of disorders?
Firstly, I'd like to emphasize that the longer an individual has had the disorder, the harder it can be for them to conquer it down the road. So the emphasis is always trying to nip it in the bud and focus on recovery as soon as possible. Now, breaking down into the categories with anorexia, a lot of these women can live for a very, very long time with very few lab abnormalities, surprisingly, considering how hard they are on their body. But one of the main concerns with someone with pure anorexia nervosa is when they lose their period, their menstrual cycle, they can start to have calcium leaking from their bones and develop osteoporosis. Moving on to bulimia nervosa, the purging behaviors are the main concern due to inevitable electrolyte abnormalities, and we worry about heart arrhythmias. We worry about fainting episodes or syncopal episodes due to dehydration. Some women can develop tears in their esophagus or in their stomach, so we do worry about GI bleeds, and there can be changes in the esophagus from the acid that is encountering tissue that is not made to withstand the acidic pH of the stomach. So people are more prone to esophageal cancer, and there could be dental erosion from the acid on the teeth. Going on and on, but clearly these are worrisome concerns, and the medical stabilization is first and foremost in everyone's minds.
Okay, so it can also have a very serious impact on the individual's life, where it's going to disrupt their relationships or their work or their job or their social functioning. Can you speak a bit about that, Linda?
Well, eating disorders always, in addition to the very real medical consequences that Dr. Geis just highlighted, have very severe social and emotional ramifications. Even if somebody doesn't have obsessive-compulsive disorder or depression or anxiety, they're likely to experience symptoms of those. And so there's actually a very high suicidality rate with eating disorders, which is concerning too.
Is that because of the illness, or because of how they feel about themselves and maybe the shame involved with that?
Probably a combination.
Okay.
The reality is there are brain chemistry changes that, again, Dr. Geis could speak to, that are very severe. We see not just distorted thinking, but really almost delusional thinking at a certain point of starvation. We also see distorted body image that becomes very, very exaggerated. So those are the conditions for a young woman or man or boy or girl whose self-esteem is totally based on weight and shape. They might become, very despondent as a result if they think they've gained a pound or two, which, of course, is part of the treatment recovery process. So being in treatment, most eating disorders do progress without treatment. So seeking treatment early, as Dr. Geis said, and continuing to finding experts and programs and making sure that the treatment is effective is key to making sure that somebody doesn't actually have, a fatality or something related to an eating disorder. So those are some of the more physical factors. But the depression, anxiety, social isolation, cognitive functioning that severely affects concentration. So we see students that are normally good students that fail courses, or sometimes people with eating disorders have a amazing mind over matter, so they can actually continue to pull out the A, but that doesn't mean that they're not struggling. So jobs, et cetera, all impacted.
Okay, and what we actually do know is that eating disorders are treatable. So let's talk about some of the treatment options. Rachel, why don't you start with telling us a bit about your treatment center? It's called La Ventana, and just let us know a little bit about what someone could expect if they were to come to your treatment center for treatment.
Great. Yeah, so La Ventana is a treatment program in Santa Barbara that offers several levels of care. So there's partial hospitalization, which basically what that means is there's treatment offered up to 7 hours a day, up to 6 days a week. There's also intensive outpatient, which means that it's about 3.5 to 4 hours a day, up to 6 days a week. So there's several options of levels of care dependent upon what's needed for a patient or for somebody, as well as their schedule and just their life needs. We also offer supervised living if someone is in need of housing. We offer that for people, as well as transportation to the treatment and to the program, so they have a safe place to to heal and to focus on their work. What someone can expect is to be welcomed and to not be judged. And someone can expect to have people there who understand what they're going through and who we're not going to judge them. And they can also expect to have a full assessment and really a lot of information gathered on what is going on for them, their history, and what might be the best way to move forward and what kind of treatment they specifically are going to need.
those types of treatment there include things like individual therapy, group therapy. You would definitely see a medical doctor like Dr. GIES to assess and perhaps medicate some underlying issues. Can you tell us a little bit about those?
Yes, you're exactly right. So we are so lucky to have Dr. GIES with us as a resource. And so we have Dr. GIES to track the patient's medications as well as their medical health, which is so important. We also have individual therapy, and so clients get seen on an individual basis every week. We also work with the families, and so we have family therapy available. And eating disorders affect the whole family. Everyone gets affected, and so we really want to provide services to not just the person struggling with the eating disorder, but friends and family as well. We also have lots of groups, and so we focus on coping skills and providing just alternative means of coping with stress and emotions other than turning to food. So we really look at not just the symptoms, but what's driving it, what's the underlying reasons. In addition to that, we provide meal support, so structured, supervised meal support, meaning that we eat lunch with clients, we have snacks with clients, we have dinner with clients. So we're really there with them where the rubber meets the road, where they're facing their anxiety and their fears. So we have therapists there to walk them through that.
So really what you're saying is that all they really need to do is pick up the phone or walk through the door for the first time, and that they can be assured that this is a safe environment, that there is a lot of support and a lot of help, and that the people who are there know what this is about, have been through it, and will be there to help them.
Absolutely.
Okay. Linda, tell us about your center. Now, this differs a bit from La Ventana. First, tell us how it does, and then tell us what your treatment center provides.
So the Eating Disorders Center of Santa Barbara, LLC, is newly opened. It's an intensive outpatient program, so it is sort of the last level of a tier of treatment that Rachel mentioned. It is more of a, my style of program is going to be a little bit more of a boutique, smaller program, maximum 6 patients at a time. It will include a supported meal. The focus is on results-based structure that allows clients to have a supported meal, in that way very similar to La Ventana, process their feelings in a group setting with trained therapists, dietitian, then go home and practice in their own environment. It will be 3 3-hour groups per week. Midweek, Monday, Wednesday, Friday will be the initial schedule from 5:30 to 8:30. So it's intentionally designed to work with students' schedules and with working people's schedules. I'm going to be starting out with adults, and we're just forming the first group right now, and eventually I'll be adding an adolescent program. Mm-hmm. And there will also be individual counseling included, as well as dietary counseling. The focus will be on both the behavioral aspects of an eating disorder and working with those, but also working with the underlying issues, and personal skill development, personal effectiveness, life skills, helping people move from their eating disorder as their focus to reaching out for life and relationships to meet the needs that they may be turning to their eating disorder to meet.
And do both of your facilities take men, women, and what ages?
So yes, at La Ventana we take both men and women, and we see usually adolescents from about 13 years of age and up.
Okay, and
I will be accepting men and women, 17 and up initially, and then an adolescent program to follow. And we are seeing more men in exhibiting eating disorders and more boys, so it's good to know that boys and men should feel welcome as well.
And is there a best way to help somebody to intervene with someone who has an eating disorder? Is there a best way to go about that, whether it's with a child or an adult?
Absolutely. And, I always recommend approaching somebody non-judgmentally and respectfully and choosing an appropriate time and setting. So it's not helpful to, approach somebody or catch them off guard or in a setting where they're not comfortable. So timing makes a difference. Making sure that it's in a private place, and it's always good to use I statements to share. What I've observed, what I've seen, what I'm concerned about is X, Y, Z, and really maybe pinpointing some specific behaviors or specific concerns, and again to speak from one's own place of care and concern and how maybe it's affecting themselves. And so non-judgmental, respectfully, and maybe coming to the table already with some resources, some information, and some resources for help.
Yes, I think it would be very powerful to someone who is going through this, struggling, thinking that they're the only one, thinking that they're kind of locked into this and that there is no one else out there that understands them, to really be able to have something to show them and something to tell them about so that they know that there are places to go and that there is full treatment and that it can be understood. So we need to take one more quick break here, and I will be right back with my guests right after this break.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
The issue today is eating disorders, and my guests are experts in the field. I'm here with Dr. Marjorie GIES, Rachel Finch, and Linda Wells, and they are all in part responsible for excellent treatment here within Santa Barbara County. One of the questions I have is, what are some of the common myths about eating disorders? Dr. GIES, do you want to start with that?
Well, one is certainly that an individual with anorexia never eats. They simply don't eat enough to meet their caloric need. And also, when people hear the term anorexia nervosa or anorexia, they think the individual is not hungry. The word anorexia is a medical term, and when used by itself, it does mean loss of appetite. But anorexia nervosa, these individuals are often starving. They're very hungry. They simply aren't allowing themselves to eat what they need. Other myths would be if someone looks a normal body weight and size, that they can't possibly have an eating disorder. And there are many individuals who look normal to the eye that are actually suffering. I guess the last one that's coming to my mind is whether subclinical eating disorders are serious. And they are, because inevitably many lead to more serious disorders that become chronic and hard to treat.
And are there real risks for developing an eating disorder?
Certainly there's many risks, and I often think about it as a perfect storm. There's several factors that contribute to it. One would be someone's personal temperament. Mm-hmm. Oftentimes we see characteristics of perfectionism and anxiety in an individual. Someone who seeks a lot of control because of that need for perfection. Certainly some other risks would be a family history of an eating disorder or addiction. And so that tends to be passed down genetically or through the family, as well as just being exposed to media and our cultural values. There was a study that was done some years ago in Fiji where there was really no incidence of eating disorders until American media was introduced to their culture, and they found that there was a drastic increase of eating disorders in the inhabitants there and those who lived there, with purging behaviors and high concern on body image. So that was a strong indication that our culture and our American media makes a strong difference.
And I know for some that parents start to feel guilty that perhaps they've done something with their parenting style that has either caused or created this. Does that tend to be true?
I just want to jump in because I work with so many parents that feel guilty or responsible or that they're going to be blamed. And research has shown repeatedly that parents are not the sole cause of an eating disorder. Any sick child from any ailment is going to elicit a response from a family and parents. So remembering that when a child is sick with an eating disorder, the parents are going to become more they're going to, envelope their child. They're going to become more concerned, maybe more anxious, and even potentially controlling. But we're seeing truly the response in the moment of having a sick child.
And part of treatment is to work with the family because it does become kind of a family issue. So family therapy is a very big part of the treatment when they come to some of these centers, correct?
That's correct.
Okay. And do you find families willing to come in and see it as a family problem and really, be there to help their child or the other adults within the family?
In my own experience, this is Linda speaking, usually family members and loved ones are actually the people who help initiate getting somebody in the door. Most people with eating disorders are fairly reluctant to come to treatment. Mm-hmm. There's a lot of ambivalence. So those people are really the wind beneath the wings of our clients. And lots of times learning how to support that person, and sometimes that's a little bit more tough love, mm-hmm. depending, or it may be more compassion and forming a deeper relationship with that individual that actually becomes the health that allows that client to move beyond their eating issues or begin to reach out again to the family or a life partner or, for a child to reach out to their parent to meet emotional needs. So family therapy is key. Social support, be it a boyfriend, roommates, you name it, can make all the difference. And we want to bring the eating disorder out of isolation mm-hmm. and help that person feel genuinely supported.
And I would think that's part of why a treatment center with support groups, with other people who are working the program, provides a social network for these people.
Yes. I mean, the group support is tremendously powerful. Okay. And I think many clients will say after the fact that the silver lining was both the people they met through the treatment process and the way their lives shifted and changed as a result of their treatment. So there is a happy ending if somebody sticks with it.
Okay. And what is the length of treatment? And what is the cost? Perhaps we should cover that too. And are there other low fee or free options also available within the Santa Barbara County?
Very good questions. Treatments can last anywhere from 1 month to several months to 5 months. There's many factors that contribute to that. However, I will say that recovery is said to last anywhere from about 5 to 7 years. It can be a very long process. But I will highlight the fact that that doesn't mean someone has to be suffering intensely for those 5 to 7 years. There is help available, and it can get better during that length of time. In terms of intensive treatment, at one of our programs that we're talking about, it might last for several months.
And the reality is, the wonderful thing about these treatment options, both locally and actually nationally, the eating disorder field is really advanced as far as treatment options, is that there are levels of care. If somebody's serious, they may need to even be in an acute hospital. And then they'll be able to step down to ideally a residential setting and from there into their own community where they may be part of a day treatment program or partial hospitalization program. and probably the final level would be an IOP, intensive outpatient program, and then individual counseling ongoing from there, and dietary counseling and psychiatric counseling.
Yes, and this is Rachel again, and I just want to also share that we do have some free groups available to the community. We have at La Ventana, we have an Eating Disorders Anonymous group, and what that is, it's a free support group for those struggling with an eating disorder or those who know someone who has an eating disorder. It's free. It's at 6 p.m. on Mondays at La Ventana. We also have a free support group on Thursday for friends and family.
All right. Well, I want to thank all three of you for being here, Dr. Marjorie GIES, Rachel Finch, and Linda Wells. I will have all of their contact info on my website for you to be able to contact them. But thank you very much for the work that you do, as well as to be here on the program and to talk about this and to just make other people know that there is help out there, and you are, of course, there to do that. They just need to make that first phone call.
Thank you.
Thank you.
All right. I will be right back after the break for some closing comments.
You are listening to Dr. Kim Taylor on KZSB AM 1290.
Well, that was a very quick hour, but I hope full of great info. If you missed some part of this, that you definitely can go to my website at drkimtaylorshow.com or go to iTunes and download the podcast there. I will also make sure to post all of my guests' contact info on my website for you to have. And I was very happy, again, to have Dr. Marjorie GIES, Linda Wells, and Rachel Finch to talk about eating disorders and the different kinds of treatment centers that are available here in our city. So I really want to thank you for joining me, and I hope that you will join me again next Thursday afternoon. Most of the time it is live at 5, but what happens next week is I am actually going to be out of town, but I'm going to have an encore presentation of one of the shows that I really loved, and it was called Getting Out of Your Way. It was with my guest, Dr. Mark Goulston, and we had some fun with this because don't we all get in our way at some point in our lives? And the truth is that who holds us back the most is ourselves. Whether it's your fear, whether it's your doubt, whatever it is, we are the ones that hold ourselves back. So this show is all about that, and I think we give some really good tips on how to move past that. So that's up for next week, and after that, I will be live back here on Thursday at 5. So don't forget to listen to the rebroadcast right here at KZSB, AM 1290. This is every Thursday evening at 10 p.m. and Sunday mornings at 9 a.m. Again, if you would like to send any comments or questions, you can do so via my email at drkim@drkimtaylorshow.com. So thank you, Mark Giles, my new engineer. I am so excited to be here in this drive time hour, and I hope that you find me here and that you too will join in and have a question and just call in. I would love to hear from you. Meanwhile, have a great week or 2 weeks, and until then, remember, no one else has to change in order for you to get better. Take care.